Welcome to this training on scaling up country readiness and support for the COVID-19 response. This is Module 1, where we look at mission and purpose of this program. By the end of this learning package, you will be able to do several things. Number 1, describe the overall purpose of this learning course. Number 2, list the learning objectives and the target audiences. Number 3, be able to motivate yourself and others about the importance of implementing the strategic preparedness and response plan for the COVID-19 outbreak at your country level and to complete this course. And finally, you will be able to describe the basic features of the COVID-19 outbreak. The aim of this course is to help UN country teams coordinate and scale up preparedness and response to COVID-19. What we really want to do is to reduce avoidable deaths and illness due to the outbreak. And we want to ensure that there's a tailored access to health measures against the outbreak. The COVID-19 outbreak poses a challenge for all countries. The World Health Organization, as the United Nations Specialized Agency in Public Health, has led the global response to COVID-19 so far. On February 3rd, WHO launched a Strategic Preparedness and Response Plan, the SPRP. This outlines the support measures that are needed to enhance the COVID-19 response and preparedness of the UN member countries. On February 12th, the Operational Planning Guidelines to support country preparedness and response was released. This intends to provide a practical guide for the UNCTs and partners to immediately, quickly support national governments to prepare for and respond to COVID-19. This learning module is a companion to the Operational Planning Guidelines. It is intended for use by UN country teams and other relevant stakeholders. This can include partners, donors, civil society for particular modules. It details actions that support national readiness and preparedness for COVID-19 within each of the 8 pillars of the SPRP. It intends to enhance international coordination and help countries increase their capacity to respond to COVID-19. The timeline for the COVID-19 outbreak has been in the press, and I'm sure you've read it in the media already. But just to recap, on December 31st, 2019, China alerted WHO of several flu-like cases in Wuhan. On January 5th, WHO advised against travel restrictions. On the 7th of January, the virus was identified as coronavirus. At that time, we called it 2019 novel coronavirus. On 11th January, the first coronavirus death was reported. On January 22nd, the first emergency committee was convened under the international regulations by the Director General of WHO to decide what was required to be done from the global community. By the end of January, on January 31st, WHO declared a public health emergency of international concern under the international health regulations. By February 3rd, WHO's Strategic Preparedness and Response Plan was finalized and released. The following day, on February 4th, WHO requested the activation of the UN Crisis Management Policy to establish a crisis management team. A few days later, on February 6th, UNDCO and WHO briefed all resident coordinators and UN country teams on the Strategic Preparedness and Response Plan. By February 11th, WHO gives a new name to the coronavirus. It is now called COVID-19. February 12th, the SPRP operational planning guides were released. The aim of all of this is really to support UN country teams in providing guidance to national governments and partners in scaling up the response to COVID-19. WHO's Strategic Preparedness and Response Plan aims to do this. The three core strategic response areas are: number one, to rapidly establish international coordination and operational support; number two, to scale up country readiness and response operations; and number three, to accelerate priority research and innovation. 8 major areas, or what we call pillars, of the public health response and preparedness system have been outlined in this. There's also a monitoring framework and a tool to assess and to plan for resource requirements. In order to enable UN country teams and partners to support national governments to do this, we have a concrete step-by-step guide to scale up response quickly. Priority steps and actions to be included in the CPRP across the major areas of public health preparedness and response. And the document outlines a mechanism to estimate resources that will be needed at country level for the different interventions to address COVID-19. This guide does not supersede existing national guidance and plans. It should be used to rapidly adapt existing relevant national plans, including NAPHs, the PIPPSs, and focus the support for international community. These learning modules are intended for use by several audiences: all members of the UNCT on an individual basis, resident coordinators, humanitarian coordinators, and other pillar and agency leads. These leaders are asked to encourage all UNCT members to complete this online learning as an initiation to the response at country level. We also want the UNCT focal point with responsibility for monitoring and implementing this guidance, donors and other relevant stakeholders, and in some cases civil society and the public, to take this online course. WHO hopes this will increase transparency and create the necessary support required for effective work at the country level. This learning course is entirely online and can be accessed via the Open WHO app if you want to use it offline. You can also use it in low bandwidth settings. It can be done in one sitting of between 90 and 120 minutes, depending on how fast you are, or in short bursts of time if required. It has 3 modules. The module that we're in now is the first module, and it focuses on the mission and purpose of the program. And it includes an introduction to COVID-19. It will give you the basic knowledge on the outbreak. It should take no more than 15 minutes. The second module is about country-level preparedness planning. It should take about 30 minutes. And for some of you who are taking this, there is a third module on the navigation and the user training of the digital tools that are accompanying this. That should take about 45 minutes. At the end of the modules, you will be able to print out a confirmation of participation, and there will be an additional record of achievement. So here's the learning package in its entirety. The first module is for all stakeholders, UN country teams, the resident coordinator or humanitarian coordinator, all country administrators, implementation partners, donors, and the public. And as was just said, it focuses on the mission and purpose of the program and gives you an introduction to the outbreak. The second module is for RCs and HCs and UN country team pillar leads and members, and it focuses on country level preparedness plan. Module 3 is for all platform users, global admin, country partners and viewers, and it focuses on navigation and user training of digital tools. And as you will see, there is a logic to this. Module 1 is really about advocacy and creating engagement of a broader audience. Module 2 gives you more precise, more useful information on the country level preparedness planning. And by Module 3, it is really about in-depth review of the 8 pillars and it provides a user training for resource mobilization and monitoring. So the overall learning objectives of this program are to describe the principles and core requirements of the COVID-19 Strategic Preparedness and Response Plan, to explain the objectives of the operational planning guidelines to support country preparedness and response and outline next steps for country leads, and finally to list the 8 major pillars for preparedness and overview of activities for scaling up country readiness and response. We have 3 more objectives. Be able to access the full set of activities, performance indicators and resources. Detail levels of preparedness activities for each of the 8 major pillars and how progress across the levels can be achieved. And be able to proactively monitor and increase preparedness levels using the provided online tool. These objectives are for those taking Module 3. This training course, all 3 modules, are intended to help you digest the core documents that are mentioned in this training, from the strategic planning level to the monitoring tool. We hope that you take some time to do this and that you encourage all your team members to take the appropriate modules. If you have any feedback, please send it to us on openwho.org. Thank you.